Hi, I'm Dr. Dean. I'm an eye specialist in Nelspruit and Mbombela. Today I want to talk about gas versus oil. In retinal surgery, often in macular hole surgery and in retinal detachment surgery, one needs to put a tamponade in the eye, something that pushes up against the back of the eye, either to help close a macular hole or to keep a retinal tear dry and flat while the laser is working. And so we have two options. We can either use gas or oil. So I want to talk just briefly about the pros and cons of those two so you understand exactly why one would choose one over the other. So firstly, with gases, we have different types of gas. We can put air in the eye, we can put SF6 gas in the eye, C2F6 or C3F8. So those are the types of gases we use. And the reason we use those different types of gases is because they last different lengths of time in the eye. What do I mean by that? If you inject a bubble of gas into the eye, let's say air, that air slowly becomes absorbed and that bubble gets smaller and smaller and smaller over time until it disappears. This happens by itself. And air in general will probably last between 5 and 10 days in the eye before it disappears, normally around about a week. If we want a gas tamponade to last longer, if we want the retina to be supported for a longer period of time, air is not going to be sufficient because it will be out the eye in a week. And so we use other types of gases. SF6 can last about 14 to 16 days. C2F6 can last about 4 weeks. And C3F8 can last anywhere from 6 to 8 weeks. So they last different lengths of time. So we can choose what type of gas we want depending on the length of tamponade we feel we need depending on the surgery. The advantage of using gas is that you don't need to remove the gas. The gas absorbs and disappears by itself. And people often say, well, what replaces the gas in the eye? If you've taken the vitreous and you've taken the gel out and you put gas in the eye, what replaces it? Well, your eye produces fluid all the time. It's constantly making fluid. So your eye produces fluid, and as your gas bubble becomes absorbed, what happens is your eye fills itself up with fluid. As the gas bubble disappears, there's fluid in the eye. And what patients notice in the beginning, the vision is very blurry. You can't see through a gas bubble. You basically just see blurry. So you essentially will be monocular. The one eye will see very little while there's gas in it. And you start firstly seeing a crescent of fluid. And as the bubble gets smaller and smaller and smaller, you see more and more and more. Now, the gas bubbles obviously float up. So people always say, well, why do they see well at the top and it moves down? It's because everything in the eye is inverted. So although your gas bubble is at the top and fluid collects at the bottom and the gas bubble moves up, what you notice is that you see a line at the top and that line moves down, down, down. Eventually you can see over the top of the gas bubble. That gas bubble moves down, 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 and eventually the gas bubble disappears completely and it's gone. Depending on the type of gas, it can take different lengths of time. The disadvantage to gas is that you cannot travel with gas in your eye. Well, you can travel, but you can only travel at one altitude because gases are sensitive to pressure. The same way as if you put a packet of chips in your car and you drove from Nelspruit to Johannesburg, that altitude change from about 600 to nearly 2000 will cause that packet of chips to expand. You will see that the actual bag becomes feels like it's under tension. And the same thing happens with gas in the eye. And the gases we use in the eye are quite sensitive to altitude change. So as you travel up a mountain pass, what will happen, that gas bubble will expand, and that's in your eye, so the eye pressures will go up. And if the pressures go really high, there can be problems besides pain and discomfort. There can be vein or artery occlusions and other issues that can happen if you go to altitude. So you need to stay at a similar altitude while that gas is in your eye until your doctor says, okay, it's safe to travel, particularly not getting in an airplane. So any air travel is restricted while you've got gas in your eye. So that's the big con of gas, and you need to be aware of that. So gases in general for retinal detachments are used more routinely. It is normally what we prefer for routine, simple retinal detachments, single breaks, single tears. that don't have scar tissue or haven't had multiple detachments or other complications, we try to use gas most of the time. Silicone oil is normally used for more complex surgeries, more complex detachments, patients who have had redetachments, patients who have scar tissue or PVR as we call it, multiple breaks, multiple holes or other issues, we may elect to use silicone oil. So silicone oil, the main advantage to silicone oil is that when you put it in the eye, if you fill the eye with oil, it doesn't get smaller. It stays the same size, it doesn't shrink, and so you've got this constant tamponade in the eye. It's not that gets smaller and smaller. The other small advantage to oil is that directly after surgery, you can still see through oil. Unlike gas, you can't really see through the gas bubble. Through oil, you can see through the oil. It's not clear, and it's definitely not the same as having fluid in your eye, but you can still see, so you can still navigate with oil in your eye. So that is a small advantage of having oil. The other big advantage to oil is that you can travel. You can travel to altitude, you can fly in an aeroplane. You're not restricted because it's not sensitive to altitude. So if traveling is an issue, especially if a patient has a detachment and they immediately need to fly back home, occasionally we have patients who have come to the Kruger that have developed a detachment and they're from Switzerland or Germany, etc., and they need to get home quickly, then we may elect to use oil so that they are able to fly. So that's the advantage. The disadvantage is the obvious one. You have to take the oil out. So sometime in the future, once the surgeon's happy that the retina is stable, one can then go and remove that oil. There are some other issues with oil. Sometimes one can get problems with pressure. Oil can emulsify and then can cause some issues. But in general, if the oil is removed tirelessly, it's still a very safe option. But it depends on the detachment, the patient's circumstances, etc. The last thing to mention is just positioning. After retinal detachment surgery, particularly, you may be asked to position on one side or the other because the gas, or even oil, but gas particularly, it floats onto the surface. So depending on where the tear is and where the gas is and where we want the gas to tamponade, we will suggest to the patient to position on the left side or the right side, face down, etc., depending on where we want that gas to push. As that gas bubble gets smaller, it becomes more important to position because there's less of a gas bubble to tamponade. So positioning often is more important when one is using gas, and that can be a frustration for patients. Patients being told to lie on the left side in 10 days. Often patients struggle to do that. Often with oil, it's less of an issue. If you've got a full full of oil, positioning becomes less of an issue because it's a big bubble of oil, it stays in the eye, doesn't get smaller. Positioning is often less of an issue. So that's another pro of using silicone oil. That's the basics of gas versus oil that is used for vitrectomy surgery. If you have a vitrectomy, if you have a PPV, you're going to have something put in the eye, and it's routinely, if there's no issues, we just use air. That'll be out in a couple of days. If you've had a detachment, good chance that you'll have one of the gases. If it's a complex detachment, oil. And if you have bacular hole surgery particularly, you definitely will have the longer acting gases put in the eye. So I hope that was helpful. I hope that was interesting. But if you have any more questions, please feel free to reach out to us and we'll try our best to help.